My name is Toribio Natividad. I'm an orthopedic surgeon, board certified in orthopedic surgery. I went primarily to medical school for the sole purpose of getting into orthopedic surgery. It's a natural extension from physical therapy. I love the musculoskeletal system, rehabilitation, and I think my previous experience and background and knowledge in physical therapy is a normal extension into orthopedics. So I was born in California, but moved here at age 10. My parents are native El Pasoans, so this is essentially my home. And I embrace El Paso and our culture and the diversity that we have here. I've been in practice since 2011 and been a team physician for the UTEP athletic department since then, and serviced essentially all the high schools in El Paso and the surrounding community. So I have a great relationship with the athletic trainers. It's really quite an honor to be able to take care of our young athletes from our middle school to high school to Division I UTEP, and then to our general population, all the way up to our elderly individuals that maybe need a shoulder or knee replacement. Quite frankly, to service our community, a community that's in need, a community that can benefit from a bilingual physician, I'm honored to do so. A lot of times people come to us and it's been not only weeks, but months, maybe even years that they've been dealing with pain, and maybe they've seen other practitioners that have done an injection and had x-rays, and maybe it hasn't been delineated that the real problem is, in many cases, like a rotator cuff tear of the shoulder, where they've been treated conservatively, appropriately, but maybe after a long duration and they just haven't gotten better. And what they needed was that further expertise or focused evaluation to find out really what the issue is. That's one great thing about orthopedic surgery. It's always evolving, both technologically with new surgical techniques as well as the instrumentation that we use. So my specialty is primarily knee and shoulder reconstruction, all the way from simple surgeries that are arthroscopic surgeries to reconstruction and even joint replacements of the shoulder and joint replacements of the knee. That being said, our technology has improved significantly in many areas, in particular sports medicine, with new advances in minimally invasive type surgeries that can get our athletes and individuals back sooner. So I think a great patient-physician relationship is a physician that will listen to their patients and take the time to treat them just as they would treat their family member. And that's something that I strive to do. I think I'm very humble from the standpoint of being a physical therapist for 8 years. My wife is a nurse practitioner, so she equally keeps me grounded. And with that, I think that all physicians, whether you're a surgeon or not, are not above anybody. We should be very holistic and comprehensive in our care and be able to provide the best care we can to do no harm and to treat each person as if they are our family members. So, I went to medical school and to become an orthopedic surgeon to service those in need. And, we're never taught that we expect anything great from our patients, a gift or a card. A simple thank you is more than enough. And when a patient becomes emotional and just can thank you for helping them get back to life, and they said that you're in their prayers, it gets me emotional. And it makes me realize that all that training that I did and all those years of sacrifice on multiple levels was worth that one person that I was able to impact. When I'm not in clinic and operating, the devoted time I have is to my wife and to our 6 kids plus our 1 miracle baby that is now 10 months old. And so we have a beautiful family that society might call a blended family. But to me, it's my family. And I love them with all my heart. And that's where my spare time goes.